بسم الله الرحمن الرحيم. أبنائي الأعزاء، اليوم راح نبدي بموضوع جديد بالنسبة إلى محاضرات اليانتي لهذه السنة، وراح نبدي بموضوع ear diseases of the ear. وكالعادة احنا راح نبدي بالanatomy of the ear. The ear is also called the vestibulo-cochlear apparatus, اللي معناها انه the ear is the organ that deals with hearing and balance. So the functions of this audio vestibular apparatus of the ear is the functions are the hearing and the balance. Actually, to simplify studying the ear, there is an academic subdivision of the ear into three parts. This is not an actual, this is not a real division of the ear into three parts. This is an academic to simplify studying the ear from all aspects, whether from the structure, from the physiology, from the pathology, and so on and so forth. So we have the external ear, we have the middle ear, and we have the inner ear. If we come to this diagram, we'll see that from this part, which is the only visible part of the ear, which we call it the auricle or the pinna, and then we go through this canal, which we call it the external auditory canal. They form what is called the external ear. So the external ear is of two parts, the pinna and the external auditory canal. تنتهي الاكسترنال ear بما يسمى بالتمبانيك membrane. التمبانيك membrane هو عبارة عن connective tissue partition that separates the external ear from the second part of the ear, which is the middle ear. The middle ear is the site where we do have the ossicles, these auditory ossicles. The middle ear primary function, the main function of the middle ear, is to transmit the sound waves from air to bones, then to fluid. From air to bones, then to fluid. These bones, which they transmit the sound waves into the third part of the ear, the inner ear, are three in number, and they are called the malleus, the incus, and the stapes. The third part of the ear is the inner ear, which is called the labyrinth, and two parts here. The part which is responsible for the hearing is called the cochlea, مثل الحلزون, and the part which is responsible for balance is called the semicircular canals. And we'll come to discuss this point in a matter of detail later on. هنا يعني يريد يراويكم الباسج of the sound waves والultimate changes اللي ممكن يصير. شوف هاي sound waves, they are coming from the external environment, from the exterior. They are directed by the now the sound waves are coming from the external environment. They are directed by this pinna or auricle toward the external auditory canal, and then they induce a vibration in the tympanic membrane. This vibration will be transmitted into the ossicles of the middle ear, and then the transmission or the vibrating waves will be conducted into the inner ear, where the sound energy will become an electric energy, an action potential, and this action potential will be transmitted into the vestibulocochlear nerve, into the brain, central nervous system, for final analysis and perception. هذا راح نرجع للموضوع. Now let's come to discuss the first part اللي هي الاكسترنال ear. مثل ما قلنا الاكسترنال ear تتكون من الاوريكل او اسمها الثاني the pinna, then external auditory canal, and tympanic membrane اللي هو structurally is related to the external ear, functionally is related to the second part اللي هو middle ear. بس الأوريكل اللي هي هاي شكلها. This is the auricle. The auricle is the only visible part of the ear. It is connected with the side of the skull by ligaments and membranes. The auricle is nothing but a single piece of yellow elastic cartilage that is covered by perichondrium So back again, this is the only visible part and is made of a single piece of yellow elastic cartilage and is attached to the side of the skull. It has got two surfaces. هذا الأوتر surface ولا lateral surface اللي يتكون من مجموعة من ال depressions and projections or eminences يعني مثل الجايرة أو سبكاي بالبرين. طبعا the main features of the lateral surface هو helical border or the helix, the tragus, the lobule. Remember these terms. The tragus is opposed by what is called antitragus, the helix, antihelix. Okay? Now, so the important eminences here, helical border of the auricle, antihelix, tragus, and antitragus. The important depressions هي الكونكا التراينجولار fossa and the scaphoid. الكونكا هي اللي تقودنا إلى مدخل الاكسترنال auditory canal اللي نسميه external auditory meatus and is being protected by this tragus. طبعا the only part which is devoid of cartilage is called the lobule. Instead of cartilage there is fibrofatty tissue, and this fibrofatty tissue is a good source for graft material, which may use it in tympanic membrane perforation grafting. Now the auricle has got a sensory nerve supply. طبعا كل شوي نتذكر. 4 nerves give a sensory supply to the auricle. The auriculotemporal nerve, the auricular branch of the vagus, the great auricular nerve, and the lesser occipital nerve. The lymph drainage of the auricle was superficial parotid anteriorly, mastoid posteriorly, with superficial cervical lymph node inferiorly. نيجي إلى second part of the external ear اللي هو external auditory canal. This external auditory canal is a curved tube اللي هو S-shaped tube that leads from the auricle to the tympanic membrane, and it has got two parts. لو نرجع هنا external canal راح نشوف إنه this is the external canal. It has got an outer cartilaginous part and an inner bony part. The inner bony part هو temporal bone. The outer cartilaginous part هو cartilage. هذا contains طبعا هذا is lined by skin which contains the skin appendages اللي هي hair follicles واللي هي sweat and sebaceous glands. في حين البوني part ما بيها هاي الأشياء. وعادة الواكس producing glands, you know wax هو الشمع مالت الإذن. The glands that produce wax are found here in the external cartilaginous part. Okay, now the two parts are at an angle with each other. They are met at the angle, so we can't see the whole of the canal without straightening the external canal. Without straightening of the external canal. So straightening is an essential step during the examination of the external canal. So the two parts are met at an angle, therefore the pinna should be pulled upward backward and outward to straighten the canal, at direction of pulling the pinna, to facilitate examination of the external canal and the tympanic membrane. اللي هاي العملية نسميها بالأوتوسكوبي. شوف هاي changes اللي تصير when we would like to straighten the canal. We pull the auricle upward, backward and outward, then the canal will become straight. يعني المياتس راح يصير قدام الtympanic membrane. وهنا نشوف this is the proper technique of examining the ear, that's the external canal, the tympanic membrane, by this instrument اللي سميناها بالأوتوسكوب. طبعا the right ear is examined by the right hand. شوف how to hold the otoscope. We hold it like a pen and we support the cheek with this finger. The other hand is to straighten the canal. هذه opposite side. زين. Now, wax is composed of secretions of sebaceous glands, ceruminous glands, hair, desquamated epithelial debris, keratin and dirt. هذا هو يعني composition of the wax. So it is the product of these sebaceous glands modified. يعني sebaceous gland will modify the sweaty glands اللي هي ceruminous glands. ويا ينخبط ويا هذا البرودكت، هذا السكريشن عندنا الهير، عندنا disquamated epithelial debris، وعندنا الكيراتين، وعندنا dirty material اللي تدخل إلى external ear. The wax is produced in the lateral part of the ear canal by small glands within the skin. Wax has a protective function as it lubricates the ear canal and entraps any foreign material. Impacted wax gives rise to impairment of hearing, giddiness, earache, tinnitus, and reflex cough. So, when you have an impacted wax, معنى إنه the external canal is filled with wax. All of the external canal is filled with wax, so it is called impacted wax. So the patient will present طبعا primarily with hearing trouble. يعني راح يجي يقول أنا ما أسمع بهاي. Sometimes نقول giddiness يعني معناها dizziness، معناها vertigo. Earache, because of the pressure of the wax on the tympanic membrane. Tinnitus from blockage of the external canal. Or reflex cough, هذا irritation of the vagal branch, the auricular branch of vagus nerve. نعم. وهذا الرفلكس كف احنا ممكن يصير ويانا ايضا. واحد من ينظف ايدنا نشوف مرات يصير عنده قحة، هذا رفلكس كف. Treatment of wax is to remove it by either syringe or by instrumental manipulation. شوف هذا هو impacted wax. To remove it, either we use a syringe filled with warm water and then we push it in certain direction and then we remove the wax, or by some instrumental manipulation اللي هو section. Alright, اللي هو section. Now, there are some congenital anomalies affecting the auricle. وواحدة من عندهم هي البات ear أو يسموها protruded ear، يسموها إذن الوطواط. نشوف احنا قلنا the auricle is attached to the side of the skull by ligaments and muscle. الانجل بين هذه الاوريكل وبين السكال should not exceed 30 degree. If it is more than 30 degree, then this is called bat ear. خصوصا إذا congenital and bilateral. When bat ear is due to the يعني maldevelopment of the antihelix. لما الانتيهليكس is maldeveloped, then we call it the bat ear. So, bat ear is a congenital protrusion of the auricle. It has no functional consequences. The normal angle between the auricle and the skull is 20 to 30 degree, and this angle increases due to the lack of development of the antihelix. It is usually bilateral and needs to be corrected at preschool age. And this is the correction. شوفوا هذا الانتيهليكس شوف شلون صار prominent، في حين انه لو نشوفه هنا بهاي الصورة راح نشوف as if there is no antihelix. So other congenital anomalies طبعا ممكن تكون هذا الأوريكل is protruded unilaterally but not congenital. This is an acquired condition because of the post-auricular swelling which is seen in acute mastoiditis. هكذا راح تمر بينا مصطلحات otitis externa or post-auricular hematoma from trauma. Other congenital anomalies of the auricle: microtia اللي هي عندنا small auricle or anotia absent auricle. Other congenital anomalies of the external canal هي هذا البريوريكولار sinus. والبريوريكولار sinus هو عبارة عن sinus, sinus is a connection between the skin and the paracterium, and has got its external opening either in front of the helix or the tragus. وهذا طبعا is a congenital anomaly that results from failure of fusion of the pieces of the auricle during embryonic life. The auricle is developed from the first and second branchial arches, 3 pieces coming from the first, 3 pieces from the second, and they unite with each other and they form the auricle. There is failure of union of these, we'll end up with this preauricular sinus. Our accessory auricle, which is nothing, just an accessory tissue. The second part of the ear is the middle ear cleft, and the middle ear cleft is found between the tympanic membrane and the inner ear, the cochlea and semicircular canals. This space is called the middle ear. It is called cleft. The cleft يشمل 3 أشياء. Eustachian tube اللي هو عبارة عن osseo-cartilaginous passage between the middle ear and the nasopharynx. And the primary function of this middle ear, of the Eustachian tube, is ventilation of the middle ear. Ossicles هاي اللي حكينا عليها بالmiddle ear would never functioning well unless they are ventilated, because the main media for action of these ossicles to transmit the sound waves هو وجود air in the middle ear. The second part is the middle ear cavity. شوف احنا قلنا cleft. Second part سميناه tympanic cavity. The third part was mastoid antrum and mastoid air cells. Alright? The tympanic membrane is a thin fibrous structure covered. طبعا الآن نجي مدخل إلى الميدل إير هو التمبانيك membrane. هو عبارة عن fibrous structure, thin fibrous structure between the middle and the external ears. Externally it is covered by skin, internally it's covered by mucous membrane. The main framework of this tympanic membrane هو collagen fibers. The collagen fibers in the tympanic membrane are found in two directions, the circular and the radial. سراح راويكم الصورة مالت التمبانيك ممبرين. هذا هو التمبانيك ممبرين. شوف هذا هو السكن on the outer side. بيقابله من الجهة الثانية هو mucous membrane، هو عبارة عن respiratory epithelium. In between اكو عندنا الفايبرس layer اللي تنطي السترينث هذا مالت التمبانيك ممبرين. framework of the tympanic membrane. There are certain features when we see the tympanic membrane. طبعا التمبانيك membrane هو oval shaped structure, is attached to the bony canal by a fibrous rim نسميها بالسلكس بالفايبرس انيولس. وهاي الفايبرس انيولس موجودة بالسلكس تيمبانيكم اللي موجود اللي هي نهاية الاكسترنال بوني كانال. طبعا الفايبرس انيولس تقريبا معظم circumference of the tympanic membrane except this part which contains no اللي يسموه بالاتيك region يسموه النوتش أو برايفينس. التمبانيك ممبرين يتكون من جزئين. هذا الجزء الكبير نسميه بالبارس تنسا، في حين هذا الجزء الصغير نسميه بالبارس فلاسيدا. الجزء اللي بي fibrous layer هو التنسر. that's why it is tense. هو المين surface area of the tympanic membrane موجودة هنا. في حين الجزء اللي ما بي fibrous layer اللي only skin and mucous membrane نسميه بالبارس flaccida. بالبارس تنسر عندنا this يعني ossicle اللي هو الماليوس. في حين الماليوس this is the second ossicle أيضا ممكن نشوفه بعض الأحيان. this is the incus and this is the longer process of incus وهنا موجود الستيبس. الآن الماليوس is attached to the tympanic membrane by this part اللي نسميه الهاندل. والهاندل ينتهي بهذا الجزء نهايته نسميها الأنبو. الأنبو راح يسوي لنا this light reflex. when we apply a light on the surface of the tympanic membrane, the shadow of this ambu will become called the light reflex or the cone of light, which is triangular in shape. Its base is toward the periphery and its apex is attached to the ambu. طبعا التمبانيك membrane purely grey in color. purely grey يعني هو لؤلؤي لماع in color. Now the general features of the tympanic membrane, it is oval in shape with a diameter of, its diameter is about 1 cm. It lies obliquely at the end of the canal. It forms an angle of 45 degrees with the floor of the external auditory meatus or external auditory canal. It is concave toward the canal, and at the depth of the concavity is a small depression in semi-lambu. في حين it is convex toward the middle ear. هاي handle of malleus is attached firmly to the pars tensa حكيناها و to the inner surface of the membrane. Tympanic membrane from the malleus, two processes, fibrous processes will extend نسميهن malleolar folds from the margins of the tympanic annulus. Between them, and above them, there is a small depression of the tympanic membrane, small part of the tympanic membrane اللي ما بي fibrous layer نسميه بالpars flaccida. زين. الآن the tympanic membrane has got a nerve supply from the auriculotemporal nerve or from the vagus on the lateral surface. On the medial surface, its sensory supply is coming from the glossopharyngeal nerve اللي هو ninth cranial nerve. كل ساعة راح نحكي عليها بعدين هالرفاقاتات. Now, Eustachian tube هاي حكيناها قلنا عبارة عن osseo-cartilaginous passage that connects the nasopharynx with the tympanic in the middle ear cavity. It's about 36 millimeter in length. Its posterior 1/3 is bony. I mean, its medial 1/3 is bony في حين its lateral 2/3 is cartilaginous. عكس external auditory canal. It serves to equalize air pressure in the tympanic cavity and the nasopharynx. The pressure on both sides of the tympanic membrane should always be equal so that you could maintain the action of the ossicles of the middle ear. See, this is the cartilaginous part of the Eustachian tube اللي هو يفتح إلى النيزوفارنكس. This is the bony part which opens into the middle ear. طبعا الجزء الكارتليجينوس is potentially closed. It opens during certain maneuvers like swallowing, like yawning, like sneezing. هاي راح تفتح الستيكين tube. But during this short period of opening, اللي هو تتجاوز 0.1 second, the air will come to the tympanic cavity, to the middle ear cavity, and the secretion will be drained into the nasopharynx. Now, the middle ear cavity اللي هو عبارة عن air-filled space within the temporal bone, which contains the auditory ossicles, and it communicates with the nasopharynx through the auditory canal. هذا وين؟ هذا anteriorly. Laterally it is attached to it is related to the tympanic membrane. Medially it's related to the inner ear. طبعا in front it anteriorly it communicates with the Eustachian tube. Posteriorly it communicates with the mastoid process, the mastoid air cell system, through what is called an opening that we call it the adytus ad antrum. لو نجي هنا نباوع راح نشوف انه this is the opening of Eustachian tube. This is the tympanic membrane. وكأنه فتحنا الآن التيمبانيك membrane. شوف هذه هي البارس تنسر. شوف الارينجمنت مال fibrous layer. هذا الهاندل اللي هو attached to the pulse tensor. هذه posterior opening اللي راح تؤدينا إلى mastoid air cell system. هاي نسميها الاديتاس ad antrum. هذا ossicles arrangement مالته. يعني هذا هو الماليوس، هذا الانكس باللغة العربية السندان، والانكس بشورت بروسيس اللي بلونج بروسيس اللي يجي يشلب بالستيبس اللي هو الثيرد ossicles. والستيبس is attached to the inner ear through the oval window, so the sound waves will become transmitted through these ossicles. طبعا هاي الاوسيكلز they are united with each other by synovial joints. The other content of the middle ear هو the presence of muscles. عندنا two muscles which they control the movement of the tympanic membrane and the hearing mechanism. هي tensor tympani والstapedius muscle. tensor tympani هذه الاتاشت مالتها إلى الماليوس. its nerve supply is trigeminal, mandibular branch of trigeminal nerve. في حين الstapedius muscle highly attached into the stapes and is supplied by the facial nerve because it is a muscle of the second branchial arch. The middle ear cavity has 6 walls. Lateral wall اللي هو tympanic membrane. Medial wall اللي هي الinner ear. Anterior wall هو Eustachian tube. Posterior wall هي الماستويد اللي هو الاديتاس ad antrum. Superior wall هو الروف اللي related to the middle cranial fossa, the what's called tegmen tympani. Floor هو related to the jugular valve اللي هو الجugulار internal jugular vein. هنشوف الساعة. These are the walls. See, anterior wall is related to the Eustachian tube. Posterior wall is related to the mastoid air cell system. Superiorly semi roof إلى middle cranial fossa or temporal lobe of the brain. Inferiorly هاي jugular valve اللي هو internal jugular vein. Now the tympanic cavity has got 3 parts. The upper part is called the epitympanum or the attic. The middle part is called the mesotympanum اللي تقريبا معظم الاوسيكلز يعني جزء من الاوسيكلز موجودة به لأن معظمها موجودة بالابيتympanum بالاتيك. والهايبوتympanum اللي هو الجزء السفلي من الميدل اير cavity. We have 3 auditory ossicles. The malleus, which is the largest ossicle, and it has got a head and a handle and short or lateral process. The handle اللي ينتهي بالأنبو هذا اللي مشلب بالبارس tensor of the tympanic membrane. The head is making a joint with the body of incus. يسموه الانكيدوماليولار joint. The body of incus has got 2 processes. Short process اللي يروح يشلب بالاتيك region، ولونج process اللي ينزل للميزوتympanum and يسوي articulation with the stapes by and again a synovial joint. The stapes be head وبي 2 crura وبي foot plate. الفوت plate هذا اللي موجود وين؟ بالأوفال window. موجود وين؟ بالأوفال window. شوف هسه هذا الارينجمنت مالته. هذا التيمبانيك ممبرين. شوف هذا الجزء اللي مشلب بالتيمبانيك ممبرين من الماليوس نسميه الهاندل اوف ماليوس. هذا اللاترال بروسيس هذا اللي نشوفه صراحة الكيميائي صوت التمبانيك ممبرين. الهيد والبودي اوف انكس موجودات وين؟ بالابي تمبانوم، بالابر بارت of the middle ear cavity، بالاتيك region. muscles حكينا عليهم قبل شوية. وإذا تتذكرون إنه التمبانيك ممبرين قلنا هو عبارة عن thin fibrous structure that separates the middle ear from the external ear. It is composed of 3 layers: an outer stratified keratinized squamous epithelium, and an inner one which is a low columnar epithelium, the mucous membrane, and in between there is a fibrous layer which is arranged in 2 directions, in radial and circular direction, and this is called the middle layer of the tympanic membrane. Now the tympanic membrane is fixed to the external auditory canal, that is to the temporal bone, by a fibrocartilaginous rim that sticks the tympanic membrane into a groove found on the temporal bone, which we call it the sulcus tympanicum. Because this groove is shallow, we need to increase the fitness and the fixation of the tympanic membrane to the temporal bone. Therefore, the periphery of the tympanic membrane will become condensed so that we could increase the firmness and the fixation of the tympanic membrane to this sulcus. This rim is called the fibrous annulus. This fibrous annulus is deficit in the superior part of the tympanic membrane, اللي هو الاتيك region. Now, the tympanic membrane is made up of 2 parts. One part is large, which we call it the pars tensa, and the pars tensa is composed, the tympanic membrane here is composed of 3 layers. That is the outer, middle and inner layer, while a small layer which is called the pars flaccida, and this is deficit in the middle layer. In some of the textbooks they said that it's not any deficit, but it is less well developed in this part of the tympanic membrane. If we look to the tympanic membrane, most of the surface area of the tympanic membrane is related to the pars tensa. The whole surface area of the tympanic membrane is about 85 millimeters square, but the effective surface area اللي يصير بها الفايبريشن هي بحدود 55 square millimeter. In the pars tensa we have embedded part of the meatus, which is one of the ossicles of the middle ear. هنا تشوفون هذا الستركتشر is part of the meatus. هنا اللي هو بالاتيك region اللي هي تتكون من البارس فلاسيدا والاوتر اتيك وول، لان هاي البارس فلاسيدا جزء من الاتيك region، من lateral wall of the attic region, but it is not the whole attic region. This bony partition here, or the bony wall here, is the remaining of the outer attic wall اللي نسميه بالسكيوتم. Now the head is there, while the lateral process of malleus is found here, and from which we have the handle of malleus, which is extended vertically down, Now, the tympanic membrane is described as being purely gray in color, that is the pars tensa, is purely gray in color, and it is translucent because it is stretched due to the presence of the fibrous layer, and sometimes it is transparent. Transparent means thin tympanic membrane, but it's not always thin. If it is thin, we could see the rest of the ossicles here. Here in the posterior, طبعا البارس tensa back again, the handle, which is descending vertically from the lateral process of malleus down to the center of the pars tensor, نسميه الأنبو. This bulbous end of the handle is called ambu, from which the cone of light is radiating or is originating. Now, behind this we have the long process of incus, and here is the stapes. These are the ossicles of the middle ear. هنا نقدر نشوف if the tympanic membrane is thin نقدر نشوف ال incudostapedial joint. Now, for simplifying, describing the lesions in the various compartments of the tympanic membrane, we have established an imaginary division of the tympanic membrane by two lines, one horizontal across the ambu and one is parallel or in line with the handle of malleus. So the tympanic membrane will be divided into four quadrants: two anterior, upper and below, and two posterior, below and upper. Posterior, superior quadrant of the tympanic membrane is very important clinically because it is anatomically a thin and a weak part of the tympanic membrane. Most of the perforations develop here. The incudostapedial joint is found here. The retraction pockets that will lead to the development of cholecystoma اللي راح نحكي عنها بعدين بالchronic attactus media is found here. So هنا نشوف incudostapedial joint if the tympanic membrane is thin enough to see the incudostapedial joint. Now, between the neck of malleus and the long process of incus we have the passage of the chorda tympani nerve اللي هو مسؤول عن التست sensation of the tongue. ومرات نشوفه يعني إذا tympanic membrane thin, you may see the nerve is coming like this from posterior to anterior direction. طبعا general features of tympanic membrane, it is oval in shape, its diameter is 1 cm, it lies obliquely at the end of the external auditory canal, making an angle of 55 degrees with the floor of the external auditory canal. On the lateral aspect it is concave, يعني toward the external canal it is concave, and the center of this concavity is called the ambu. The center of this concavity is called the ambu. While on the other aspect of the medial aspect of the tympanic membrane, it is convex. It's called convex. Now, from the lateral process of malleus, we have two folds of ligaments going to attach to the margin of the tympanic membrane. نسميهم الماليولار folds اللي تروح إلى margins of the sulcus tympanicum. طبعا هاي الماليولار folds راح تفصل البارس تنسر عن البارس فلاسيدا، يعني the middle ear cavity from the attic. Okay, so the nerve supply of the tympanic membrane is its anterior part هو Auriculotemporal nerve اللي هو branch of the mandibular division. The posterior هو from the vagus. Posterior half of the tympanic membrane is from the vagus nerve. The medial surface of the tympanic membrane is supplied by the glossopharyngeal nerve اللي هو one cranial nerve. That's why the referred otology from most of the regions supplied by the glossopharyngeal are transmitted by this nerve into the ear, and the patient may practice some otology due to some inflammatory conditions, say in the tonsil, in the teeth, in the temporomandibular joint, and so on and so forth. The patient is complaining of pain in the ear, but the examination is normal. The cause is not in the ear. This is called referred otology. الآن ندخل الآن إلى الميدل ear. الميدل ear هو عبارة عن air-filled space that is made up of 4 walls with a roof and floor. See here, this is the middle ear cavity اللي هي جزء من الكليفت. هي عبارة عن 6 sided box, 6 walls box, and is filled with air. Anterior wall, posterior wall, roof, floor, medial, lateral. lateral هو التمبانيك membrane. هذا انتهينا من عنده. اجي الميديال wall هي الانر ear. And here in the medial wall we have this bulge اللي نسميه promontory اللي هو جزء من الكوكليا اللي مثل basal turn of cochlea. Behind the promontory, below is the round window. Above is the oval window where the stapes is attached through its footplate. Anterior wall has got 2 openings. One for the passage of the Eustachian tube into the middle ear, and one is for the passage of the tensor villi palatini muscle, اللي هي the muscle that is responsible for widening and opening the Eustachian tube during sneezing, during yawning, during swallowing, and so on and so forth. The second muscle, okay, so in the anterior wall we have 2 openings. One, the large and below, is for the Eustachian tube. The small and above is for the tensor villi or tensor tympani muscle, which is supplied by the trigeminal nerve. The posterior wall has got a large opening in its upper part, which communicates the middle ear with the mastoid antrum and mastoid air cell system. This is called the adytas and antrum. Below this there is a projection, which we call it the pyramid, from which is coming the stapedius muscle, the smallest muscle in the body, that comes from this pyramid to attach into the neck of the stapes. These 2 muscles, they control the conduction of sound waves and the ossicular mobility. The roof of the middle ear, is related to the temporal lobe of the brain, and this is a very thin, that's why it's called tegmen tympani. Likewise, the floor, again it is thin and is related to the jugular bulb of the internal jugular vein. Sometimes it happens that there is some dehiscence here and the jugular bulb may enter or may bulge into the middle ear. ممكن نشوفه during otoscopy that there is some redness is coming from the floor of the middle ear. Alright? This is all what is related to the middle ear. طبعا this is the facial nerve. The facial nerve in middle ear has got horizontal segment, and then طبعا هناك عندنا lateral semicircular canal راح نحكي عليه بالinner ear. Behind the lateral semicircular canal راح ينحني الfacial nerve حتى يسوي vertical part, which will leave the temporal bone through the stylomastoid foramen to go and to supply the muscles of facial expression. So the walls of the middle ear, we have 6 walls. The lateral wall is called the tympanic, يعني tympanic membrane. Medial wall اللي هو labyrinthine, اللي هو lateral wall of the inner ear. The anterior wall is a more carotid, the 2 opening, one for tensor tympani, one for Eustachian tube. Posterior wall is called the mastoid. Superior wall is called the roof or the tegmen tympani. The floor is the jugular wall. هذا طبعا راح كل شيء يلخص لكم الموضوع. تشوفون هنا this is the Eustachian tube اللي هي عبارة عن osseo-cartilaginous junction that passes between the nasopharynx and the middle ear. 2/3 of the course of the Eustachian tube is cartilaginous and 1/3 is bony, axial external auditory canal. طبعا the part which needs to be closed most of the time is the nasopharyngeal part to prevent the reflux of the secretions into the middle ear. This is the jugular bulb and this is the floor of the middle ear cavity. This is the temporal lobe of the brain and this is the thin roof of the middle ear cavity نسمينا التجمنت. This is the adytus وهذا هو الانتروم وهاي هي الاير سيلز. هاي هي lateral semicircular canal. Below the lateral and medial to the lateral semicircular canal we have the second genu of the facial nerve. وبعدين شوف هذا it will go vertically to pass through the stylomastoid foramen. هذا باختصار موضوع الميدل اير اناتومي او التمبانيك كافيتي. بعدين قلنا التمبانيك كافيتي تتقسم الى upper part سمينا الابيتمبانو او الاتيك اللي الاوسيكلز اللي بالهيد اوف يعني ماليوس وبالبودي اوف انكس. from the head of malleus is coming the handle اللي attached to the tympanic membrane والlong process اللي going down into the middle part of the middle ear and becomes attached here to the footplate of or to the stabes. This is called the head of stabes. هسه خلينا ناخذ شوي فكرة عن الاوسيكلز الموجودة بالميدل ear. Ossicles الموجودة بالميدل ear we have three ossicles. The malleus اللي نسميه المطرقة اللي يتكون من head و neck و handle. من النك يطلع اللاترال بروسيس اللي نشوفها بالتمبانيك ممبرين. الماليوس طبعا الباسج مال الهاندل مالته يكون vertical بالبالس تنسل. If it happens that there is some negative pressure in the middle ear, the tympanic membrane will be retracted in this direction. So the malleus will go posteriorly and نسميه foreshortened handle of malleus. Foreshortened يعني بدل ما يكون vertical راح يكون a little bit horizontal toward the posterior segment of the tympanic membrane. لما يكون هذا يعني foreshortened, the lateral process will become very prominent لأن الtympanic membrane ينسحب فكلش راح تبرز lateral process of the malleus. The second ossicles, which is the weakest ossicle, is attached to the malleus by synovial joint and to the stabes by another synovial joint. هو حقيقة is floating between the malleus and the incus لأن ثابتات بس هذا ضعيف. Okay? بس هذا هو ضعيف. الآن الستابس has got two crura. This is head. طبعا بالنسبة للإنكس back again this is the body, this is the long process. The body of incus والhead of malleus موجودات بالأتيك region and they are protected from the exterior by the presence of the outer attic wall اللي هو bony outer attic wall وجزء من عنده هو البالس flaccida. Two processes coming out from the body of the incus. One is the short process which is responsible for fixation of the incus into the attic region, and the longer process which descends down to articulate with the stabes through its head. Then طبعا الانكس يسموه بالعربي السندان. الستابس يسموه يعني يشبه حدوة الفرس الركاب يسموه. هاي التو كرورة وهذا الفوت بليت. فالفارس من يصعد وين يخلي رجله هنا بالفوت بليت ويصعد ولذلك يسموه بالركابي لأن يشبه ركاب الفرس. حكينا عن auditory ossicles. Auditory ossicles and their relation with the tympanic membrane هصورة كلش حلوة. حكينا عن auditory muscles. هسه نجي إلى the last part of the ear اللي هي inner ear. inner ear الحقيقة تتكون من bony part و membranous part. bony part و membranous part. bony part يتكون anteriorly من cochlea, centrally vestibule و posteriorly semicircular canals which are arranged in three directions: superior, inferior اللي نسميها posterior والlateral semicircular canal, one each at right angle with each other. That's the canals. Inside each of these bony cavities there is a membranous tube which we call it the membranous labyrinth. بين الosseous labyrinth اللي هو البوني labyrinth والmembranous labyrinth there is a fluid اللي نسميه بالperilymph circulating there. While inside the membranous labyrinth we have another fluid اللي نسميه بالendolymph. Now, inner ear is two in everything, two in number. has two parts, cochlea vestibule, two functions, hearing and balance, two major symptoms, dizziness and deafness. زين. This is the bony labyrinth اللي يتكون من الكوكليا اللي هي عبارة عن 2.5 turn bony structure. طبعا هذا التيرن is around a central axis اللي نسميه الموديولس، بالضبط مثل العمود وتفتر عليه الكوكليا. هذا العمود اسمه الموديولس، والكوكليا تلتف حول نفسها 2.5 مرات. السنترال بارت اللي نسميه الفستيبيول. الفستيبيول has got two opening toward the middle ear. The upper one is oval in shape ونسميها الأوفال window اللي يتشلب بها الفوت plate of stapes. والlower one is the round window which is covered by a secondary tympanic membrane. And three semicircular canals, one superior, one posterior, and one lateral. اللاترال هذه اللي هي نشوفها احنا related to the يعني posterior superior segment of the middle ear. كل وحدة تنتهي dilated opening into the vestibule نسميها الأمبولا. And this is called ampullary end of the semicircular canals. Now, the cochlea is the organ of Corti. The vestibule is the organ of static balance, controlling static balance. بحين السيميسيركولار canal هو الأورجن of dynamic balance. الأورجن الجزء الموجود يعني الsensory organ that is responsible for the اوكي في حين لا يحتوي هذا على سنسوري ابيثيليوم اللي هو مسؤول عن الدايناميك بالانس بنسميه بالكريستا، ولانه بالامبولا صار اسمه كريستا امبولاريس. في حين هذا مسؤول عن الدايناميك بالانس. شنو يعني دايناميك بالانس؟ من نمشي احنا نمشي او دو كنترول ذا بالانس او ذا بودي مسؤول عن اللاترال او السيمي سيركولار كانالز. الفيستيبيول مسؤول عن الستاتيك بالانس، والسنسوري اورجن which is responsible for controlling the static balance نسميه بالماكيولي. نسميه بالماكيولي. Now, if we have a cut through the labyrinth, we will see that the membranous labyrinth. طبعا membranous labyrinth هو هذا مجموعة من التيوبس موجودة داخل البوني labyrinth. هاي semicircular ducts، هاي cochlear duct اللي ملتفة again 2.5 turn, and this the vestibule has got two parts, the saccule and the utricle. اليوتريكل يشبه اليوترس، ولذلك شوف السيميسيركل كانالز تنتهي بي التيوبس. اوكي تنتهي بي. These are the ampullary end of the semicircular canals. Okay. If we have a cut through the membranous labyrinth, we'll see that's in the cochlea that there are three compartments. One is filled with perilymph, one is filled with perilymph, upper and lower. The upper is called طبعا كل واحد نسميه scala بمعنى compartment. The upper one is called the scala vestibuli لأنه related to the oval window. نسميه scala vestibuli. The lower related to the round window نسميه بالscala tympani لأنه بها tympanic membrane فسموه scala tympani. ذني بيناتهن أكو تواصل بحيث البيريليمف يعبر منا ومنا. في حين الميدل كومبارتمنت يسموه السكالا ميديا هذا مغلق يحتوي على another fluid يسميه الاندوليمف، وهذا يصير triangular in shape بحيث انه البيز مالته هو الريزنر ممبرين اللي تقعد عليه الأورجن أوف كورتي، اللي هو the organ that is responsible for hearing, for the act of hearing. okay. الأورجن أوف كورتي أكو فوقها التكتوريال ممبرين، ومن عند يعني بالأورجن أوف كورتي موجودة الهير سيلز اللي responsible for detection and perception of sounds، اللي مسؤولة عن تحويل sound energy into electric energy as an action potential, which will go into the cochlear part of the vestibular cochlear nerve and then into the brain. So the cochlea is a snail shell. It opens into the anterior part of the vestibule. It consists of a central pillar and semimodulus, around which a hollow bony tube makes 2.5 spiral turns. The membranous cochlea, scala media, is blind tube that divides the bony cochlea into two compartments. اللي هي السكالا ميديا هذا حكيناه اللي تحتوي على الأورجن أوف كورتي. Functions of the ear here: balance and hearing. Symptoms of ear disease basically هي إما deafness أو dizziness.